Hey everyone, Dr. Ryan Westbrook here. If you're over 60 or if you're watching this because someone you care about is over 60, then this video is absolutely critical for you to see. Because here's the thing, vitamins become a totally different ballgame after you turn 60. Your body changes. Your digestion changes. The way you absorb nutrients changes. And what worked for you when you were 40 doesn't work anymore. In fact, some of the vitamins that are perfectly safe for younger adults can actually become problematic as you age. Today, I'm going to break down exactly which 4 vitamins you should be very cautious about taking, and which 4 vitamins most people over 60 genuinely need. And I'm not talking about guessing here. I'm talking about what the research actually shows. Let's start with the bad actors, the 4 vitamins you should really be careful about if you're over 60. Number 1, vitamin A. Now, I know what you're thinking. Vitamin A is essential. You need it for your eyes. That's absolutely true when you're younger. But here's what happens with age. Your body doesn't clear vitamin A out of your system the way it used to. It accumulates. It stores in your liver and fatty tissues. And when you're over 60, too much vitamin A has been linked to bone loss and increased fracture risk. The research is pretty clear on this. Studies have shown that people over 60 who take high-dose vitamin A supplements have weaker bones and more osteoporosis. The thing is, if you're eating a normal diet with vegetables, you're getting beta-carotene, which your body converts to vitamin A only as much as it needs. That's the safe way. But if you're also taking a multivitamin with vitamin A plus a separate vitamin A supplement, you're potentially creating a problem. For people over 60, the upper limit for vitamin A is 3,000 micrograms per day. Many supplements blow right past that. Number 2. Vitamin E in high doses. Vitamin E gets marketed as this powerful antioxidant that's going to protect you from everything. But here's the reality. If you're over 60 and you're taking high-dose vitamin E supplements, we're talking 400 international units or more daily. Studies show this increases your risk of bleeding problems. It can interact with blood thinners, which many people over 60 are taking. It can increase your risk of hemorrhagic stroke. And honestly, most people over 60 don't need vitamin E supplements at all. You get plenty from nuts, seeds, and oils. Number 3. Niacin, also called vitamin B3, in high doses. Niacin is part of your B-complex vitamins, and yes, you need B vitamins as you age. But high-dose niacin, and we're talking doses above 35 milligrams daily, can cause serious problems. It can damage your liver. It can increase your blood sugar. It can cause gout attacks. And if you're over 60 with any history of liver disease, gout, or diabetes, high-dose niacin is genuinely risky for you. Number 4. Iron, if you don't actually need it. And here's where a lot of people make a mistake. If you're a man over 60, or if you're a postmenopausal woman, you shouldn't be taking iron supplements unless your doctor specifically told you that you have iron deficiency anemia. Why? Because iron accumulates in your body with age. Too much iron oxidative stress in your body. It damages cells. It's been linked to heart disease and cognitive decline in older adults. Your daily iron requirement actually drops after age 50. If you're taking a multivitamin with iron when you don't need it, you're doing damage. So those are the 4 to be extremely careful about. Vitamin A, high-dose vitamin E, high-dose niacin, and unnecessary iron. Now let's talk about the ones you actually do need. Number 1. Vitamin B12. This is critical, absolutely critical. Here's why. Your ability to absorb B12 from food decreases significantly after age 50. It's not because you're doing anything wrong. It's because your stomach produces less acid, and you produce less of something called intrinsic factor, which is what you need to absorb B12 from food. The result? Studies show that between 10 and 30% of people over 50 have low B12 levels, and low B12 causes problems. Brain fog, fatigue, numbness and tingling in your hands and feet, memory problems, depression, anemia. The good news? It's incredibly easy to fix. You don't necessarily need injections. B12 supplements work great. Whether it's a pill, a sublingual tablet that dissolves under your tongue, or a spray, they all work. The recommended amount is 25 micrograms daily if you're taking a supplement. Your body will use what it needs and excrete the rest. You can't overdose on B12. It's water-soluble. And if you're taking B12 correctly, you'll feel the difference. Your energy comes back. Your brain fog lifts. Number 2. Vitamin D. And I want to be really clear about this one because vitamin D has become somewhat controversial, and I understand why. But the science on vitamin D in older adults is very strong. As you age, your skin becomes less efficient at making vitamin D from sunlight. Even if you're getting sun exposure, you're making less vitamin D than you used to. Plus, you're probably spending more time indoors. And your kidneys become less efficient at converting vitamin D into its active form. The result? The prevalence of vitamin D deficiency in people over 60 is genuinely high. And low vitamin D is connected to weak bones, muscle weakness, falls, fractures, infections, and even cognitive problems. Most people over 60 need supplementation. The recommended amount is 1,000 to 2,000 international units daily, and many people benefit from up to 4,000 international units. Get your level checked. A good target is between 30 and 50 nanograms per milliliter. Vitamin D is one of those supplements where more people have problems from deficiency than from the supplement itself. Number 3. Vitamin K2. Now, a lot of people know about vitamin K for blood clotting. That's vitamin K1, and you get plenty of that from leafy greens. But vitamin K2 is different. It's less common in food, and it does something really important for older adults. It helps direct calcium to your bones where it belongs, instead of letting it accumulate in your arteries and soft tissues. The research on vitamin K2 and bone health is impressive. And the research on vitamin K2 helping prevent arterial calcification is also pretty solid. Here's the thing though. If you're on blood thinners like warfarin, you need to talk to your doctor before taking vitamin K supplements. But if you're not on warfarin, vitamin K2 is genuinely beneficial. The dose is usually between 45 and 190 micrograms daily, depending on the form. Your bones and your arteries will thank you. Number 4. Magnesium. Magnesium is involved in over 300 enzymatic reactions in your body. It's essential for muscle function, heart rhythm, bone health, and nervous system function. And here's what happens with age. Your magnesium absorption decreases. Many common medications, including certain blood pressure medications and acid reflux drugs, deplete magnesium. And magnesium deficiency becomes increasingly common with age. Low magnesium shows up as muscle cramps. It shows up as irregular heartbeats. It shows up as constipation, which is already common in older adults. It shows up as anxiety and sleep problems. A lot of people over 60 are walking around with subclinical magnesium deficiency, and they just think they're getting old. The recommended dietary allowance is 320 milligrams for women and 420 milligrams for men over 60. Most people aren't getting that from food. A supplement helps. You want something absorbable. Magnesium citrate is a good choice. Magnesium oxide, honestly, is just a laxative. You're better off with citrate, glycinate, or threonate. Here's something else that's really important. When you're over 60, how you take these supplements matters just as much as which ones you take. Calcium and magnesium compete for absorption. If you're taking both, don't take them at the same time. Separate them by at least 2 hours. Iron needs to be taken on an empty stomach, or at least 2 hours away from calcium, magnesium, and certain other supplements. Vitamin D is fat-soluble, so take it with a meal that has fat in it. Your absorption will be much better. And get your blood work done. I can't stress this enough. At 60 plus, you should have your doctor check your B12 level, your vitamin D level, and your magnesium level. You should have your iron levels checked, both ferritin and serum iron. You should know your calcium status. Don't guess. The cost of blood work is minimal compared to the cost of taking supplements you don't need or missing out on supplements you actually do. Many of these nutrients interact with medications. Vitamin K interacts with blood thinners. B vitamins can affect depression medications. Magnesium interacts with antibiotics and other drugs. Your doctor needs to know what you're taking. Here's something else I want to address because a lot of people ask me about this. Should you take a multivitamin if you're over 60? The honest answer is it depends. A multivitamin is a compromise. It's not ideal. Why? Because a good multivitamin has to be a balance. It can't have too much vitamin A because of the bone loss risk. It can't have too much iron if you don't need it. It can't have the optimal dose of everything because the pill would be the size of a golf ball. You'd be taking 20 pills a day. If you're eating a reasonably decent diet, you're probably better off with targeted supplementation. You take vitamin B12 because you need it. You take vitamin D because you need it. You take magnesium because you need it. You skip the ones you don't need. Now, if your diet is really poor, or if you have specific absorption problems, a multivitamin might make sense. But you've got to get one formulated specifically for older adults. It should have less vitamin A, less iron, the right amounts of B vitamins and vitamin D, and you still need the targeted B12 and vitamin D supplementation on top of it, because even the best senior multivitamin won't have enough. I want to be really clear about something. Vitamins are supplements. They supplement a good lifestyle. They don't replace it. The most important thing for bone health over 60? Weight-bearing exercise, not vitamins. The most important thing for cardiovascular health? A decent diet and movement, not supplements. The most important thing for brain health? Sleep, cognitive engagement, and cardiovascular fitness, not vitamins. Vitamins fill gaps. They address specific deficiencies. But they're not magic. I see people all the time who are taking 30 supplements a day and wondering why they don't feel good. Meanwhile, they're sedentary, eating processed food and sleeping 6 hours a night. That's not how this works. Get the basics right. Move your body. Eat real food. Sleep 8 hours. Manage stress. Then, on top of that solid foundation, add targeted supplementation for the specific gaps. Now, there are certain situations where you might need more than just basic supplementation. If you have osteoporosis, you might need vitamin D doses at the higher end. If you have pernicious anemia, you might need B12 injections rather than oral supplements. If you have chronic kidney disease, supplementation becomes complicated and needs close medical supervision. The point is, don't decide this stuff on your own. Work with a healthcare provider who understands nutrition. Someone who's going to test you, not guess. Someone who knows your medical history and your medications. So here's the summary. Over 60, watch out for excess vitamin A. Be cautious with high-dose vitamin E. Skip high-dose niacin unless you're specifically treating something. Don't take iron unless you actually need it. And make sure you're getting adequate B12. Most people over 60 need supplementation. Get your vitamin D levels optimized. Consider vitamin K2 for bone and arterial health. And make sure you're getting enough magnesium, either from food or supplementation. These four, B12, vitamin D, vitamin K2, and magnesium, are the ones that make a real difference for most people over 60. But here's the key. Get tested. Know where your levels actually are. Work with your doctor. Don't just guess and take everything under the sun, hoping something helps. Your body at 60 is different from your body at 30. It needs different things. It processes things differently. It has different risks. Respect that. Give your body what it actually needs. Thanks for watching. If you found this helpful, please like, subscribe, and share it with someone over 60 who you care about. Leave a comment and let me know what your biggest supplement question is. And remember, this is educational information. Always check with your healthcare provider before starting any new supplement, especially if you're on medications. I'll see you in the next video.